People diagnosed with early Alzheimer's disease have disease-specific needs for particular nutrients. Those nutrients have been shown to be found at lower levels in the blood and brain compared to healthy people of a similar age. These include omega-3 fatty acids, DHA and EPA, choline, uridine, and a number of essential minerals and vitamins, all needed for the metabolic pathway generating phospholipids, which play a vital role in the renewal of synapses. Fortasyn Connect contains a combination of nutrients dedicated to meet the specific nutritional needs of a person with early Alzheimer's disease. It provides the quantities of specific macro and micronutrients needed to promote phospholipid formation in the brain, supporting its overall structure and function. A European consortium evaluated Fortasyn Connect in the Lipidi Diet clinical trial. 311 patients with prodromal Alzheimer's disease, also known as mild cognitive impairment due to Alzheimer's disease, were given Fortasyn Connect in the form of a multi-nutrient drink or a placebo once a day. Already at 2 years, significant differences between the groups were observed on a number of parameters. At 3 years, a neuropsychological test battery measured a 60% reduction in cognitive decline, while the clinical worsening of the disease overall, measured on the clinical dementia rating, sum of boxes, was reduced by 45%. MRI scans to measure the shrinking of the hippocampus, a hallmark of Alzheimer's disease, showed the rate of deterioration was 33% less. Overall, the Lipidi Diet trial results highlighted that the daily multi-nutrient support is safe, provides sustained benefits, and over a longer term, the difference between the study groups increases. The published results focus on the difference in the mean change, which illustrates the slowing of decline on a chosen parameter. This way of presenting outcomes is standard for the majority of trials, however, often not clear for non-specialists. It also requires information about the absolute scale for interpretation. Leading statisticians in the field recently proposed to convert the results to a time metric and express the intervention effect as time saved, allowing for a broader understanding of their clinical meaningfulness. Using the time component test, the results represent the difference between the intervention and control in the time to reach a specified degree of worsening, or put more simply, time saved with intervention. It's a direct measure of the time by which decline on a given parameter is delayed. In the case of Alzheimer's disease, it's a powerful result, giving the potential to extend the time patients remain independent and engaged in daily activities. Using the 2-year Lipidi Diet dataset, the time-saved analysis was applied to 3 selected outcomes of the trial, both individually and with all 3 outcomes combined. The selected outcomes with a calculated time saved were the neuropsychological test battery with a delay of 9 months, the clinical dementia rating, sum of boxes, with a delay of 10.5 months, and the hippocampal volume with a delay of 7.2 months. Taken together, the calculation showed 9 months of time savings over a 2-year period of nutritional support with Fortasyn Connect. The time-saved analysis for 3 years is not published yet, although a recent Congress presentation suggests that benefits continue to aggregate in line with the original published data from the trial.